Hello, Dr. James Bogash, expert in health longevity, and today we're going to talk about those brand new fancy cancer screening tests. Same thing with like whole body MRIs. Like we should, if you listen to the ads, like we should all be running out and having these done regardless of the cost. And there are stories of patients who found something early and it saved their life. So what does that really translate to, and is it a really good idea to have, try to screen for everything all the time? And in general, there's a saying goes that if you show somebody without a diagnosis, they just haven't had enough testing yet, because if we test enough of us, we're going to find something wrong with all of us. It doesn't mean it needs to get treated. So before we go into this particular study, which looks at is the Grail company that does the Galleri test for it screens for a bunch of different cancers. And before I do that, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. So that being said, this was a study looking at what would happen over the course of, I think the study was 3 years, if we started doing these liquid biopsies, if you will, like you draw blood and you kind of look for these. As a way of background, we generally, like 7 out of 10 of the cancers that result in deaths, we don't have screening for. The top ones, the ones we do screen for, think colon, breast, cervical, lung cancer. Why is prostate not on that list? It used to be, but it's not anymore because we realized that we were over-treating an awful lot of people, and you have to balance that against the benefits. It's the same thing with breast cancer and even colon cancer. Like, the reality is when you look deeply into those studies, they haven't really changed the trajectory of outcomes of cancer deaths. We like to think that they have, but when you really look at the data, it doesn't make that much of a difference, largely because we have to incorporate over-treatment and not just we have to look at overall deaths and not just colon cancer or breast cancer deaths. And it turns out that they're not really all that different. So what are some of the cancers that we don't have screening for that are responsible for an awful lot of death? Pancreatic, which we know is awful. If Steve Jobs and Patrick Swayze didn't have the resources to beat it, like how can the average person expect to do that? Liver, ovarian, esophageal. There's a couple other on the list, but those are the biggies that we don't generally screen for, and yet they still end up taking out a lot of us as related to cancer deaths. So this is in general, if you're going to buy it, it's a $950 test, so it's not a cheap test for the bulk of people out there. And so what did they find when they started offering this test to people over the course of 3 years? Well, as expected, there was a 16% bump in cancers found at stage 1 and 2. Like, that wouldn't be a big surprise because we're screening. There's a lot of cancer out there. A lot of it may not develop into anything. So when we look at stage 3 or 4, because the idea is maybe if we can catch these earlier, we wouldn't get to the advanced stage, and that number was a little bit underwhelming at 3%. So there's a couple things. Is if we look at longer length, so this was a 3-year study, so the argument is if we ran it excuse me, if we ran it for 5, 6, 7, 10 years, then maybe catching all these cancers earlier and treating them earlier would lead to better outcomes. It's possible, but I will tell you based on track record of other cancers that the overall cancer deaths for those particular cancers may change, but because of over-treatment or in the side effects of treatment, the overall survival may not change very much because they're dying of other things related to the treatment. So as of right now, it doesn't make sense to create a panic because we know that stress causes cancer, causes cancer is a strong statement, but not too far off. Stress plays a role in the development of all things bad when it comes to humans. And so if we're trying to do the whole body MRIs, cancer screening tests, every 6 months or once a year, we are constantly on the edge of our seats stressing about what might be happening, instead of focusing all that effort on doing all the long list of things that we know that will lead to longevity, like exercise and diet and stress management and all those things. So instead of worrying about getting the next testing done, maybe we should stress a little bit more about not exercising as much as we should be. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.